Going. Okay, hi. Assalamualaikum and good afternoon. Today's the one of our Facebook live sessions at Island Hospital, and the theme basically is Diabetes Day. It's Diabetes Month actually. November is an important month for diabetes, and the theme this year is access to diabetes care. If not now, when? So basically, what we're going to do is we're going to go through some slides, and then I'm going to talk about some access, what we mean by access, and I'll introduce some terms, and then talk about prevention of diabetes. So just note that you may hear names of medications during this lecture. It is not a call for you to go out and try buying them yourselves at the pharmacy and self-medicate. These are just informative slides. Treatment must be on the recommendation of a medical doctor. You can also visit my Facebook page actually, Endodoc Penang, for further information, where I've put up other lectures and so on. So without further ado, what I'd like to actually get across today is that World Diabetes Day is an important day. It was actually created in 1991 by the IDF and the World Health Organization. And the reason they did this was because they recognized that diabetes was a big problem, and it became an official UN day in 2006 with the passage of UN Resolution 61/225. And it's actually celebrated on the 14th of November, so it would have been last week. This is the birthday of Sir Frederick Banting, one of the people who discovered insulin along with Charles Best in 1922. So the World Diabetes theme this year is access to diabetes care. And this is basically important because insulin is certainly an important life-saving medication. In some parts of the world, you cannot get insulin. This year marks the 100th year of the discovery of insulin, and millions of people all over the world have actually benefited from this. If you were a diabetes patient and you had type 1 diabetes, for example, in 1920 or 1900, it was basically a death sentence because treatment of diabetes was very, very difficult without insulin. And what happened was, after they managed to extract the insulin from the dogs, and they purified it and they gave it to the first patients, you find that these patients actually survived and they actually became normal. So the history of diabetes and history of insulin is actually very, very interesting. We are fortunate in Malaysia because we can get insulin from Ministry of Health hospitals, we can get it privately, and even if you cannot afford to buy insulin will be provided by the government. But it's not like that in some parts of the world. So this is the message. Basically, we're trying to promote equal opportunity for treatment for everybody. And this is the theme of World Diabetes Day this year. Almost 500 million people live with diabetes, and 1 in 2 patients actually have diabetes which may be undiagnosed. So if you imagine 1 in 5 Malaysians have diabetes, almost 20%. And the sad part is that a majority, an equal number, may have diabetes without even realizing that they have diabetes. So the problem is that diabetes is very, very prevalent in our part of the world. So in Southeast Asia, we are seeing numbers of diabetic patients which were predicted to be in 2030. In 2021, we're already seeing the numbers we expected to see in 2030. The same for the Western Pacific region, which basically looks at Australia, Polynesia, some of the South Pacific islands. Rates of diabetes are very, very high. And this is very frightening, as I'm going to explain to you in a little while. So if you look at diabetes trends in Malaysia, from 2011 to 2019, the rates went up. And more frightening is the fact that, when I was in medical school, we used to say that type 2 diabetes is a disease of the old. So older people, your ama, your akong, and people like that get diabetes. But nowadays, we are seeing diabetes, type 2 diabetes in 8-year-old children, 7-year-old children. We see a lot in teenagers, and the trend is the same. If you look at the figures here, younger and younger people are getting diabetes. This is a trend which we're seeing in Malaysia as well as the rest of the world. This is very, very frightening because if you look at the rates of diabetes, in 2045, they predicted 20%. In Malaysia now, we have rates which are already well beyond that, and it's happening in younger people. The problem with diabetes is, well, one, it is a terrible disease. it has a lot of problems, and it requires patients to be highly motivated to actually comply to treatment and so on. But worse still is the fact that diabetes is associated with complications. And if you look at the the figures that of patients who came in with, for example, a heart attack in Malaysia in 2016, 2017, half of them had diabetes. More had hypertension, and a lot of these diabetics didn't know they had diabetes. So these are patients who are presenting for the first time. They're coming to a hospital and they're finding out, oh, I had a heart attack, but oh, I've also got diabetes, I've got cholesterol, I've got other things. So pre-diabetes, diabetes is associated with a high rate of complications, especially heart complications. So we are trying to say to you, look, why not prevent the diabetes before it happens? Because once it happens, it becomes very, very difficult. So once Malaysians become diabetic, the control is poor. So if you look at, this is what we call the HbA1c. I'm going to explain this later. But HbA1c is a reflection of sugar control over the last 3 months, and this is the standard. But if you look at the figure on the right box here, you will see that the majority of patients actually are not controlled. If our target is 7% here, only about 60%, 40% actually achieve targets. The rest are not anywhere near the targets. So this is the problem, because high rates of HbA1c over a prolonged period can lead to complications. The other problem is that obesity and insulin resistance drives the epidemic. So when someone is obese, the insulin that is in the body does not work properly. And this makes the patient more likely to be insulin resistant. It means that the insulin cannot work where it's supposed to work, and the glucose will remain high outside the tissues. The reason for this is primarily overweight and obesity. And if you look at the figures, Malaysia has the highest rates of obesity in Southeast Asia. Even in Thailand, where people used to be very slim, you will see that rates of obesity are increasing, but in Malaysia it's very, very high. And basically the point being that if you are obese in very early life, you can actually find that there are environmental factors. So children with obese parents more likely to become obese. Food availability, portion size, sedentary lifestyle, which means that we're not doing as much as we should. And especially with children, we give them a PlayStation, we give them a telephone, we give them computers, they play games. So the lack of exercise, going out and doing things actually contributes to all of this. Television, more than 2 hours of television a day is actually a risk factor for obesity. Now, if you ask yourself how much Korean drama did you watch, Vincenzo, and you watched it right through, or you watch any of your dramas, you know that you spend more than 2 hours a day in front of the television, and this can be a problem. So 1 in 2 Malaysians were either obese or overweight, primarily females, mainly Indians. And if you look at abdominal obesity, 64% of patients were females, and the majority again were Indians. So when you look at it, we're not saying that it's bad to be Indian or anything like that, but Indians generally have a higher risk profile for developing heart complications and other things, especially diabetes. So we need to then figure out, if we are in a high risk population, we need to actually be proactive to prevent diabetes. So if you look at this guy here, his body fat is 5 to 9%, but as you go down, it actually is a lot more. So the more you have, the more fat you have in the belly, the more likely you are to have diabetes. Same for women. You know, when you move from low to high, the risk of diabetes increases significantly. So the first start is about weight reduction, and weight loss of 5 to 10% is a good start, especially if someone has diabetes. We always refer them to the dietitian, because the dietitian will be able to counsel someone, give you good advice in terms of what you should and shouldn't do. So all of this is leading up to prevention. 50% of diabetes can be prevented. In type 2 diabetes can be prevented. So it's important that we think about prevention rather than treatment. So can we prevent diabetes? When someone has pre-diabetes, they will progress to diabetes. So what we encourage you to realize is your risk, and you should be screened regularly. So the hallmark is lifestyle modification. We try weight loss. If you can lose more than 15% of your weight, if you're obese or overweight, this will help reverse diabetes. We encourage diet and exercise, and metformin has been approved for pre-diabetes. And in some circumstances, we may even encourage patients to go for bariatric surgery, which may actually help with weight loss. So weight loss actually improves a lot of things. It reduces your risk of diabetes, it reduces your risk of heart disease, improves your cholesterol, improves your blood pressure, improves your sleep, and overall, patients generally feel better. And this is about 5 to 10% weight loss. If you can actually achieve 15% or more, then there are even greater benefits. But it's very difficult to get down to 15 or 20% without the benefits of bariatric surgery. So who should we screen for diabetes? Whether you have symptoms of diabetes, losing weight, when you go out to the toilet, you pee, and then the ants come along. You see this in Ministry of Health posters, thirsty all the time, get up at night and pass a lot of urine, blurring of vision, and so on. All of these are symptoms of diabetes. But bear in mind that a lot of our patients have no symptoms. They don't know they have diabetes. So they come to your clinic one day, you go and see your doctor and you find, suddenly my sugar is very, very high. So who is at risk? Well, if you are from a high ethnic risk population, meaning Indians, for example, or even Malays, it is a high risk population. A family history, being overweight or obese, if you have pre-diabetes or previous diabetes in pregnancy, these are all risk factors for someone who in the future may develop diabetes. In fact, it's so high in this country that we even recommend screening children who come from high-risk ethnic groups and with a very strong family history. We start screening children after puberty to make sure that they don't have diabetes. Now, how do we screen? Basically, we can do blood tests. We can do a random blood glucose, which is a blood test. We can give someone a glucose drink, which is called an oral glucose tolerance test, and we check 2 hours after the patient drinks the 75 grams of glucose, or we can check the HbA1c. Now, HbA1c is hemoglobin A1c. So what happens is the sugar that is high in the blood will damage the protein that is the red blood cell. And because of this is called glycosylation. And so here, this picture here represents a high HbA1c. So the more protein that's damaged, the higher the number. And this is called HbA1c. The good thing about HbA1c is that you don't have to be fasted, and it can be actually taken at any time of the day. So this actually makes screening easier and more efficient. So the diagnosis basically is based on a fasting level here of 7 millimoles, or a random blood glucose of 11.1. So if you have a glucose of 7 or more, or a random glucose, a non-fasting of 11.1, this is diabetes. But I want to focus on this, 5.6 to 7. If you're in the 5.6 to 7 range, this is called pre-diabetes. And this is the sort of danger zone because you want to prevent from actually moving into diabetes. And more recently, the HbA1c is actually used for the diagnosis. This has been happening for the last maybe 4 or 5 years. And this helps picking up patients who are actually diabetic, and it's easier to screen. So if you, as I've said, have a glucose tolerance test done, if your level of fasting is more than 7, and 2 hours after you drink that glucose drink, it's more than 11.1, that's diabetes. If you have only one abnormal reading, you need to repeat it. Or you can also diagnose with HbA1c, which is the cutoff level. In Malaysia, we take the cutoff level of 6.3. This is wrong actually, 6.3. So 6.3 cutoff is actually diabetes when you measure with an HbA1c. So here, internationally, people take 6.5%. In Malaysia, we have decided to use 6.3% as our cutoff because we are seeing more and more patients with diabetes. So the lower the cutoff means that we pick them up earlier. And so 6.3 is the locally recognized cutoff value. Now, how do you start preventing diabetes? Basically, it starts with a 500 calorie deficit. Now, when you're 90 kilos, let's say you want to maintain your body weight, we usually use 30 calories per kilo to maintain body weight. So a 90 kilo man needs about 2,700 calories to maintain his weight. So if you remove 500 calories from there, this is called a deficit. Then theoretically, the patient should be able to lose about half a kilo a week. This is about 1 pound. So 1 pound of fat is actually 3,500 calories. So if you remove 500 calories per day, you theoretically can remove 1 pound per week, which is half a kilo. So this is in theory. So the question is, how do you get there? So you start with a 500 calorie deficit. This is what we all tell our patients. This is why you walk 10,000 steps a day. So you minus 500 calories either by exercising or you eat less. But if you cannot eat less than 500, maybe you combine diet and exercise. So dieting, less maybe a few hundred calories, then you exercise a few hundred calories, and lo and behold, you've achieved to actually reduce your calorie consumption by 500. And this means that you can actually then maybe attempt to lose weight. Now, how do you do this? Most patients every patient that comes to the clinic will tell you, oh, I don't eat anything. Nobody, oh, doctor, what's that tampuknya? But in actual fact, you don't know what you're eating. So let's look at, let's say the person sitting next to me weighs 60 kilos. So she wants to maintain her body weight, so 1,800. So if I want to help her lose weight, what do? I need to bring her down to a calorie level of around about 1,300. So how do I do that? Well, basically she goes on a diet and she exercises. But you imagine, you need to eat 1,200 to 1,300 calories a day, but you go out for murtabak in the morning and it's already 700 calories. You eat nasi biryani with mutton, 700 calories. You eat roti john, you eat mee goreng mama, 500 calories. Chapati is not so bad, but still 300 plus calories. Nasi lemak is 500 calories. So if you imagine you eat 2 nasi lemaks at breakfast and at lunchtime, that's already almost your whole day's calorie requirement. Then what are you going to eat the rest of the day? So this is why smart eating is very, very important. Now, the other thing is, if you look at kueh, mooncake festival, one piece, look at the calorie count. You look at kacang, a lot of patients will come and say, oh, I love to eat peanuts. 1 cupful of peanuts, 1 handful of peanuts, almost 900 calories, that's 1,000 calories. So if you are 60 kilos and you want to lose weight, your almost half your day's requirement is gone because you ate some kacang. So 7 peanuts has the calorie of a bowl of rice. A bowl of white rice has a calorie of around about 250. So if you are eating kacang all the time, whether it's kacang, whether it's walnuts, whatever it is, you're supposed to eat just a few, because these are good oils, walnuts, almonds, and so on. You're not supposed to eat 1 kilo of almonds every time you sit down. Now you ask yourself, what about, sweet and sour chicken here, fried rice lah, baby squid lah, pork cutlets lah, all are in the 900 calorie range. So when you eat one of these every day, and then you combine it with whatever else you do, and it's snacking in between, you will then not lose weight, but you may gain weight. So if you go back to the 60 calorie girl sitting next to me, who requires 1,800 calories to maintain her weight, if you take extra 500 calories, you gain a pound a week. If you deduct 500, you lose a pound a week. So if you're eating 2,000-3,000 calories per day, it's almost impossible to lose weight. So the question is then, you have to choose wisely. Part of the problem is, like this small nasi lemak, you can buy this small packet of nasi lemak anywhere. It costs about $1.50. This is only about 200 or 300 calories, depending on how much santan they use and all that. But nowadays, you go to the mama shop and say, oh, doctor, saya mau jumbo. So you get the egg, you get the fried chicken, you get 1 whole lump of rice with kacang. Look at the amount of kacang on here. And then you get ikan bilis goreng and all that. This is 1,000 calories. So you imagine, this is 20 years ago nasi lemak, and this is nasi lemak now. So how do you actually then reduce the calories? So if you have taken an extra 900 calories, you have to actually walk for 3 hours to burn that. And this is why it's almost impossible, because your food consumption really is more than you ever could exercise in a day. This is the problem. If you take chocolate, you like a small chocolate bar, so 100 calories per day will lead to about 4 kilos gain in 1 year. So every single bite you take, ask yourself, do I really need this? 2, am I taking something healthy? So the gurus will tell you, okay, if you're hungry, what do you eat? You can eat a piece of fruit, you can eat a piece of maybe even maybe celery, a carrot, whatever. It's something that is low calorie. What we're trying to say is that it's not that you cannot eat, but the choice of food is very important, because for example, if you're eating a meal, your lunch, you eat a bowl of brown rice, and you're using steamed chicken, your calorie count is much less than if you are eating this white rice with a piece of fried chicken. Each teaspoon of oil is 45 calories. So what happens then is, if you have a piece of fried chicken, it's going to contain 3 or 4 teaspoons of oil absorbed into the skin. So you're already taking about 180, 200 calories, minus the rice. You haven't added all the other things in. So each meal then becomes a very big meal. 1,000 calories, 1,800 calories per day is actually quite a lot if you choose your food wisely. Now, the problem is diet alone does not work. So if you go on a 500-600 calorie deficit, after a while, after 5 years, you find that it's very difficult to maintain that weight loss. So this is why diet alone, in the long term, sometimes can be problematic, because you lose your initial enthusiasm. So when we tell patients, look, you're pre-diabetic, you need to control your diet and all that, but we also tell patients that, look, you need to exercise to assist with that weight maintenance. So weight maintenance programs are about diet and also about exercise. So before you start exercising to prevent diabetes, consult the doctor, because basically if you've not been doing anything for years and suddenly start exercising, then it can be a problem on your heart. Get a full medical checkup, maybe a stress test, check the heart, make sure everything is okay, and start slow and gradually build up. So you may want to walk 30 minutes a day, then later on maybe an hour, see what you can do. It's not about how much you can do at the very beginning. It's about gradually building up and then getting some benefit. Exercise in itself can be very rewarding. It can be very, very beneficial. This is me punching the bag, and it's very therapeutic. Walking is very good, so I try and walk 20-30 minutes near my house, and so it's very, very relaxing. So there are many benefits of actually exercising. Now, if you ask any patient, about what you perceive your exercise calorie consumption will be, walking about, say, an hour a day may burn about 300-400 calories. If you're playing recreational tennis, for example, if you, let's say, take a 30-minute walk, you burn about maybe 200 and something calories. If you play tennis for an hour, you may burn the 300-400 calories. We're not talking about Olympic style swimming. Swimming alone doesn't burn that many calories, but it's good for your heart because your heart rate goes up. So every single thing that you do has a calorie consumption, but you have to walk 3 hours to burn off 1,000 calories. So can you imagine? So if what patients tell me is, oh doctor, I go walking every morning. That's good. You go 30 minutes, you go an hour. But what happens is, on the way back, they stop at the mamak shop, have one nasi lemak, or they have one or two roti canai, and you've already eaten more than you've burned off that morning. Especially if you combine it with a glass of Dietary, kurang manis, or whatever it is. All of this adds up. So you are then in calorie, not deficit. You owe your body some calories because you've actually eaten some nasi lemak and whatever else. Had you not eaten that nasi lemak, say you've gone and you've eaten a little small portion of kway teow thang, for example, or noodles, you'll find that the calorie is less. So soup versus fried. Choice of foods are very, very important, because your exercise to deficit actually is very, very difficult. So what we tell patients is that if you're trying to do something, if you're trying to burn calories, to lose that 500-600 calories per day, you have to do it by combining a diet along with your exercise. So let's say if you run for 30 minutes, you burn 300 calories. You dance for 60 minutes, you burn 300 calories. You do kickboxing or Muay Thai, whatever it is. None of us can really do Muay Thai like the Muay Thai people, but it's still a few hundred calories. So basically, a lot of exercise leads to only about a 300 calorie burn. This is why you rely on meat. NEAT is non-exercise activity thermogenesis. So this is your mopping, your gardening, your whatever. In your body, you need to burn calories. So you either burn it by eating less, you either reduce your calories by eating less, exercising by some of the conventional ways, or you do NEAT. What is NEAT? NEAT is sweeping the floor, climbing up the stairs, parking far away from your office and walking, cleaning the house, mowing the lawn, doing some vacuuming, doing whatever it is. I used to tell patients that, vacuuming and all that is not an Olympic sport, but it is a way of actually burning calories. So when you add NEAT to your exercise, to your diet, that's how you actually manage to lose some weight. Now, when all that fails, sometimes patients who are pre-diabetic may require medication. So we use a drug called metformin. Now, metformin, patients always tell me, oh, doctor, saya tak suka makan ubat. But metformin actually came from this plant behind here. It's called Garliga officinalis. They extracted the medication. So metformin is one way. In extreme circumstances, for patients who are very obese, I told you we send them for bariatric surgery and so on. But generally speaking, there are also medications we can use for obesity, but that's another lecture in itself. So, in conclusion, what we are trying to do is prevent diabetes rather than treat diabetes. Lifestyle changes are important. Screening for diabetes is important, especially if you're at a high risk. Think of your children, think of their risk, and whether you need to change their lifestyle in order to prevent that risk from them developing diabetes. If you have diabetes or your family history is of diabetes, then your children also are at risk. One of the themes a few years ago was prevention of diabetes in children, because we recognize that children too are at risk of developing diabetes. So Penang has contributed a lot. You're talking about about 1,000 calories, maybe 800 calories in front of you. So in our own little way, Penang has contributed to the diabetes epidemic. So with that, thank you very much. I'd like to thank you for spending an afternoon listening to me, and we are ready for questions if you have any questions. Okay, so everybody's very shy. There are no questions. So with that, then I would like to thank you, and hopefully I'll see you again in the future. Thank you very much.